Welcome to the Cystic Fibrosis Foundation CF Education Day webcast, Cystic Fibrosis Diagnosis in Adulthood. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Foundation and supported through an unrestricted educational grant from Genentech. To learn more about CF clinical research, CF lung disease and lung health, nutrition, germs, infection control, healthcare coverage, and more, please watch an archived webcast on the Foundation's website. Joining me to talk about what it's like to be diagnosed with cystic fibrosis in adulthood is Mary Lou Figley. She was diagnosed in her mid-40s. And Dr. Milene Saavedra, who is an assistant professor of pulmonology at the CF Center at National Jewish Medical and Research Center. So welcome, Mary Lou. Welcome, Mimi. So the first question I have is, why did you originally go to the doctor, and how did you eventually get a diagnosis of cystic fibrosis?
It was about 15 years ago at this point. I'd been sick pretty much for about 10 years, from upper respiratory problems to colds, and then back and forth and back and forth. So I was seeing a doctor in Colorado Springs, and he finally threw his hands up and said, you need to go see a specialist, and I want to send you to an allergist because I think this is allergy related. So off I went to see the allergist, pardon me, and I saw the allergist, and she said, well, you're allergic to this and that, and we find something strange in you. You've got a problem with your IgG. So they put me on some transfusions, and that lasted for about a year, and again, I wasn't any better.
Right.
And one day she was checking out my sinuses, and she saw some polyps. So she sent me to an ENT. And the ENT wanted to do surgery, and I agreed to that. And they thought it would help. So I had surgery, and after the surgery, again, I wasn't any better. I was still sick, and he kind of threw up his hands and said, I want to test you for some genetic diseases. And I got a little confused and said, well, what? And he said, well, we're going to test you for rheumatoid arthritis and cystic fibrosis and a number of things. So that's what happened, and my results came back as positive for CFG.
And how did you get tied in with the CF Center here in the Denver area?
My ENT in Colorado Springs referred me to Todd Kingdom at University of Colorado, and that's who I had first seen about my sinuses. And he sent me off to the adult CF clinic in National Jewish, where of course I went,
Yeah, and so you were diagnosed in your mid-40s. How long ago was that?
That was 7 years ago.
Okay, so you've had cystic fibrosis for 7 years.
Yes.
So Mimi, what's different about an adult diagnosis or a diagnosis in adulthood with cystic fibrosis than, in childhood?
It's very different. I think the easiest way to think about it is that the disease wasn't diagnosed in someone who's a child. That being said, the disease developed over a much longer period of time and thus had a much lower severity. So the severity of disease is generally much lower in patients who are adults who are diagnosed. It takes a longer time for the disease to present. There are many manifestations that the disease can present with. It can happen over a wide spectrum. And finally, patients generally are pancreatic sufficient, which means that their pancreas functions properly. And so they don't have this telltale symptom that many children present with, which is that they're underweight and they're malnourished.
So what are the symptoms that an adult with who gets diagnosed with cystic fibrosis usually present with?
So like I said, there generally is a very wide spectrum of presentation, and Mary Lou actually presented several of the most common ones that we see at National Jewish and that all CF centers see around the country. So starting with the head and going down, chronic sinusitis. Many times we'll see a patient who will report that they've had multiple problems with their sinuses, multiple infections, multiple surgeries, and when you see their reports, you see that many times they're infected with a type of bacteria that can cause a biofilm. So it's a difficult bacteria to eradicate, and that is classic for infections that we see in cystic fibrosis, where bacteria such as Pseudomonas aeruginosa can cause biofilms in the lungs and in the sinuses. The next thing that people can present with, and Mary Lou has suffered with this for a long time, is asthma that's refractory to, typical therapies that work for most patients. And so that is a very common complaint. Going down further, adults can present with recurrent pancreatitis. Actually, 5 to 20% of diagnoses are made with presenting symptom of pancreatitis. Males can present with male infertility. So they're really, the manifestations are very wide, and they're not always necessarily clustered to the lung.
So what does being diagnosed with cystic fibrosis in adulthood mean for life expectancy? We know what it is in children because that's reported every year in the patient registry from the CF Foundation. But what about in adulthood with diagnosis?
Did you ask this question?
I'm sure everybody would ask this question.
No, I'm saying that because that is one of the most common questions that is asked, because the diagnosis arouses a lot of anxiety. And so we actually looked at this. We looked at this within our own clinic population, and we looked at it within the CF registry. And when our group looked at patients in our clinic who were diagnosed as adults, the median age of diagnosis, believe it or not, was 52 years of age.
Wow.
Yeah, and that's about 110 patients that we have who were diagnosed that way. And in that group, the median survival is 77 years.
Oh, okay.
And so in comparison, if you look at the U.S. population at the same time as we studied this, in a Caucasian population, the median survival is 79 years. So actually, the survival is actually quite excellent, and it goes with that kind of that milder progression, that slower progression of disease. So we also looked at the cystic fibrosis registry, which has more patients in it. It has there are about a little over 1,000 patients who were diagnosed at a later age. So their median age of diagnosis was 37 versus 2 for the childhood diagnosis. And in that group, mortality was a little bit higher. So the median survival in that group was about 68 years. So a little bit reduced. But the most important thing for us as practitioners that we took home from studying this is that looking at childhood and looking at adult diagnosis, both of them, the biggest cause of mortality is respiratory failure. And so what that says to us is that no matter what the age, identifying these patients is extremely important so that we can start aggressive lung health measures right away.
Are there any common mutations found in adults with cystic fibrosis? You'd mentioned that they're usually pancreatic sufficient. Is that correlated to certain mutations? It
can be. That's a very complicated question to ask, Leslie.
Any question about cystic fibrosis I'm finding is very complicated with an answer, so that's okay.
The thing that's hard about that question is that not only are there hundreds of mutations, but patients can actually have the exact same mutation, even the most common mutation, which is a severe one, which is delta F508. They can have the exact same mutation and have a wide range of lung disease and lung function and manifestation of disease. And so the most kind of unifying way of explaining mutations in adults is that, in general, adults have partial function of the CFTR gene, which is the gene that's involved in causing cystic fibrosis. And for that, this is amazing. If you have 10% function of that gene, you're completely normal. And so, if you have less than 4, then you're symptomatic. And so there really is, you can have quite a bit of loss of function and still be completely normal. And so in adults who present later in life, there is partial function of that gene really throughout a lot of their lifespan. And then something happens to tip them over, and then they lose that. And so that's really the most common unifying way of talking about mutations in patients who are diagnosed later in life.
Okay, so you had mentioned something and you had implied. I want to talk a little bit about how did you adjust to getting a diagnosis of cystic fibrosis, and then to also talk about what are the supports available to help an adult who just found out they have this genetic disease, you know, the adjustment period and the support for that. So let's talk a little bit about that.
My instant reaction was one of panic. I mean, my first thing was, oh, I'm going to die. I know what cystic fibrosis is. I grew up with a friend whose son was born with it. And so that was my initial reaction. I was panicked, completely panicked. And, you know, it was a good thing that I was amongst, you know, people from the adult clinic who sat me down and talked me through it. And I also have a sister that's a nurse. So that's helpful as well. But, you know, in the age of the internet,
Right.
you know, you start to claw your way through it and find everything you can, whether it's WebMD or whatever you're looking at. And, you know, it was a difficult situation because I wasn't certain as an adult how it would affect me. But I have to say that there's resources out there. You just have to be pointed in the right direction, which is why I think a thing like this is very important for us who get diagnosed later in life.
Yeah. What kind of support is available from your perspective for these adults?
So I think that one of the kind of greatest advantages if you're diagnosed with cystic fibrosis at a later age is to take advantage of CF center care. There are multiple reasons for this. The most important one is actually one which we studied in the 100 patients I just told you about that we see in our clinic. And that is that just looking at people who are diagnosed later in life, so our patients who are diagnosed at a median age of 52, when we follow them over a period of time, so this is about 4 years, giving them CF center care empowered these patients because what it resulted in was a sustained response and improvement in lung function over that period of time. If you looked at those adults without any care, they typically lose a little bit less than 1% of lung function, which we term FEV 1% predicted per year over that time. And so we actually can give them the tools that will help them maintain their lung function, prolong their survival, ameliorate their symptoms. The other thing that you can benefit from if you get CF center care is a multidisciplinary approach. So this is not a disease that just affects one little organ. It's usually multiple organs. And many times when you meet someone for the first time and you go through the organs, they'll say, oh my gosh, that could be a part of CF. I didn't even know that. That's, you know, I've been having cramping every time I eat like my whole life. And I never knew what that was and I could never eat pizza or, you know what I mean, something like that. And so you can actually draw out symptoms that need to be addressed. And so you can address nutrition, you can address multi-organ disease. The next thing that's extremely important is the issue of getting access to those treatments. And so access to treatments is critical no matter what your age is, you know, with cystic fibrosis. Clearly there are huge insurance issues in our country. These treatments are extremely expensive and going to a center can actually hook you into patient assistance programs that really centers are tuned into and know how to kind of direct patients to. And then finally, there are new treatments coming out for cystic fibrosis every day. And while a lot of these are studied in a younger population, we have no reason to expect that they wouldn't benefit someone who has maybe a milder phenotype or is presenting later in life. And so it's a fantastic opportunity to participate in that research and get access to treatments. And once they're approved, you probably will get treated with that drug earlier at a CF center versus, you know, at a place that's not accredited.
So I was actually talking recently with an adult who was diagnosed. And some of the questions they had, and so what is the severity of impact on other body symptoms, or what we think of typical, you watch TV commercials and you see, you know, advertisements for high cholesterol and heart disease and hypertension. For adults who are diagnosed with cystic fibrosis, do they have to be concerned? Do those have to be monitored too? All those potential that all other adults, whether or not they have CF, might get?
So if we step outside the lung, patients who are diagnosed with cystic fibrosis, depending on what their mutation is and what their what their manifestation of disease is, have to tend with liver disease, pancreatic issues, which include pancreatitis, multiple bouts of sinusitis, which can necessitate multiple surgeries. So, how are they in condition to go to the operating room multiple times? They may have to deal with infertility issues. So it's extremely important for any practitioner who takes care of these patients to take that one disease into account, its effect on multiple organ systems, because medicines that they prescribe may affect, the liver or some of these other organs. And treatment regimens may have an adverse impact actually on the multiple diverse organ systems that are involved with the disease.
So here's kind of a question for both of you. Does cystic fibrosis, you find it limiting your physical activity and your endurance?
Yes, it does. I mean, I was so prone to asthma when I started to get sick, and it affects it. It definitely, I have trouble, hiking, especially at a higher altitude, riding my bike. But I do know that I've learned since I got sick that, even though you might feel like you're limited, you still have to get up every day and you have to go to the gym.
Right.
Or every other day or whatever it is you're doing, because it helps you, and the more I learn about the disease and the more I learn about myself, I know I'm stronger because of the exercise. But it does limit you. Yeah. I'm careful about what I do, shall we say.
And so there's rehab and just getting trained up to be able to, whatever physical level of activity you could have would be what the physicians could help with, or the physical therapists at the care centers?
Absolutely. I mean, the ability to do exercise, it really depends on the degree of lung involvement and how well are we as a medical community able to keep that person at baseline without dramatic fluctuations in the course of their disease, frequent exacerbations with bacterial infections. How good are we at sustaining that? That being said, exercise is like a medicine in cystic fibrosis. It's widely promoted as a form of airway clearance, so as a way of clearing out the mucus plugs that develop in the disease and getting rid of airway secretions that can lead to infections and shortness of breath.
So cystic fibrosis, we know, is a genetic disease. For an adult who's been diagnosed with it, what is recommended to tell their family? I know there's concern for cousins, first-degree cousins. What should they know? What should they tell their family? Or if they have children, what should they tell their children if they've got this diagnosis?
Do you want to talk about your experience with it? Or?
I don't have kids. I have a dog.
But they're four-legged kids, but that's okay.
Believe me. But I do have, when I got sick, I have a lot of siblings. I have 7 siblings and myself. My father was deceased when I was 20, but my mother's still living. So when all this happened, they came to me and said, well, we'd like to test all your siblings as well for research. And I thought that was a great idea. It was easy enough except for the nurse. She was a little tough. But we tested everybody, and almost everyone tested positive for the same gene. Interestingly enough, none of them exhibit any symptoms other than me, and I'm the youngest. Yeah. So I don't know if that plays in or not. As far as my nieces and nephews, I have a niece who's getting married in August, and she decided to go and have genetic testing as well done, which was just recently. So we don't know if she has it or not. So I think it's pretty important, especially if you are thinking about having kids down the road.
Mimi, what do you usually tell these adults?
So this question, actually, after how long am I going to live, is really the most common, and it's very anxiety provoking. And many times the children will be in the room as well, looking at you like, oh my gosh, are you going to give me a diagnosis too? So that being said, there is, for adults who are diagnosed with the disease, there are no concrete guidelines for who should get tested in the family, who should not get tested. The only concrete guideline is actually from the American College of Obstetrician and Gynecology, which says that all women of reproductive age should be offered prenatal carrier screening when they want to proceed with family planning. That being said, since there is no kind of stated guideline, there is clinic-to-clinic variability, and the practice within our group in general is to offer testing to multiple groups. One is if there are children who are symptomatic, of the person who presents as an adult, then we recommend testing them. And if there are children who are interested in pursuing family planning, we actually tell them they should obtain the same screen that diagnosed their parent. But that being said, yes, there are, you know, and there are people who actually want more. They're asymptomatic people who want to be tested just for peace of mind, and many people do proceed with that, and as long as their insurance pays for it, usually isn't a problem.
Yeah.
But unfortunately, that hasn't really been really cleanly laid out.
Right, and defined. So last question: what wisdom? What should people who are diagnosed in adulthood or who are going through diagnosis in adulthood for cystic fibrosis? What should they know?
From my perspective, from being a patient, I think it's really important to, you know, reach out to people, talk to people. Don't think that you're in this alone, because you're not. There's lots and lots of people out there who are adults, who are older than me, that are still living. And, you know, do your research, ask questions. I mean, you know, the guys at National Jewish are great. They answer every question, no matter how ridiculous it sounds, because as you start to proceed through this process, you know, and you get different things thrown at you, which is great, you know, you kind of forget. And I'd have to say that when I first got diagnosed, I thought it was really important to bring someone with me, to be my scribe, if you will, because you don't hear things when the first thing you're thinking is when I'm going to die.
Right.
And I think it's important. Do your research and ask questions, because there's people out there who can help you.
Mimi, any last recommendations?
The only thing I would say is something I frequently say in clinic when I'm meeting someone for the first time with the diagnosis, and that is that while no one wants a diagnosis of a genetic disease, in this case, it's better to know than not to know. And the reason why is these folks have suffered from multiple symptoms that have altered their lives, changed their quality of life, and not been adequately addressed for years.
Right.
And if they actually have a diagnosis, it actually opens the door to a myriad of treatments that will probably, and we've seen this, you know, positively impact their symptoms and improve their entire quality of life. And so I would look at it in a positive way, that if you have it, it's better to know in general.
So thank you, Mary Lou. Thank you, Mimi. This was
Thank
an
you.
excellent discussion about, you know, diagnosis of cystic fibrosis in adulthood. This concludes our webcast on diagnosis of cystic fibrosis in adulthood. I would like to thank you for watching, Mary Lou and Mimi for answering the questions, Rick Vaston, the technical crew, Melissa Chin, Melissa Muller, Genentech, and the Cystic Fibrosis Foundation for making this webcast possible. Thank you.